Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'm going to give 3 key thoughts to incoming Department of Health and Human Services Director RFK Jr. Politics aside, I don't really care how you feel about the man personally. I do feel like there's some excitement and nervousness around his nomination to that position. You know, as a primary care physician and someone who specializes in obesity medicine, I am truly on the front lines of Americans' health. And really, these are the 3 things that I want RFK Jr. to focus on. Number 1, ultra-processed foods. Number 2, eliminating pharmaceutical direct-to-consumer marketing. And number 3, coverage of anti-obesity medications like the GLP-1s. Okay, let's talk about the first one, which is ultra-processed foods. I often tell patients in my practice, if you see ingredients on a package that you cannot pronounce, why would you want to put that in your body? We should be eating whole foods that don't have weirdo chemicals, weirdo additives in them. And in order to encourage people to do that, we should eliminate that type of food from our kids' school lunches. We should eliminate that from the SNAP program, which is the program that people that are using government funding to pay for foods. And next, we should put a higher cost to consumers to buy these ultra-processed foods. We should also put a warning label on them about their connection with cancer and obesity. I think as we continue to get the message out about ultra-processed foods and what they are, Americans will naturally start to eat less of them. I often think of how we've really reduced the cigarette smoking rate in America because of this type of messaging to Americans. We need to do the same with ultra-processed foods. I often find my patients don't really know what ultra-processed foods are. So if we labeled them with clear directions about their connection to poor health, I think that could be really helpful. Next, we need to eliminate pharmaceutical direct-to-consumer marketing. Why do we allow pharmaceutical companies to put ads on the television and in magazines? You know, no other country in the world besides New Zealand allows this type of direct-to-consumer marketing. And the pharmaceutical companies spend about $10 million or more a year on this type of advertising. I've never had a positive interaction with a patient who has come in seeing an ad on the television wanting a specific medication. Usually they're misinformed, they're not given the complete information, and I feel like it's contributing to the over-medicalization of America. The message that the pharmaceutical companies are sending are, if you pop a pill, your life will be better. And it's not true. We all know that there are so many things that people should do before deciding to pop a pill for so many medical conditions. And lastly, I know this may seem counterintuitive based on what I just said, but I want Medicaid and Medicare to cover the newer anti-obesity medications like GLP-1. Ozempic, Wegovy, Mounjaro, Zepbound are revolutionizing the way that we look at obesity, treat obesity, and talk about obesity. Obesity is a chronic disease that for many patients needs to be treated with medication. Yes, I will also talk to my patients about diet, nutrition, and exercise, but for many patients, that is not enough, and it's time for us to stop shaming patients that have struggled with obesity their whole lives. I've seen lives changed with these medications. Patients that never thought they could lose weight and keep it off are doing just that. And I find that when patients start to lose weight, they're motivated even more to make better dietary choices and to exercise more. In my practice, obesity is the underlying condition that causes so many other conditions like high blood pressure, low back pain, atherosclerotic disease, heart attacks, strokes, you name it. Obesity is the underlying condition for so many things. So why are we not talking about it more? And why are we not treating it better? I have people that say to me, oh, they just need to stop eating. They just need to exercise more. If that worked, we wouldn't have the obesity epidemic that we have in America right now. I know of so many high functioning, smart, disciplined people that have struggled with their weight. It's not as simple as telling patients, to stop eating so much and exercise more. We've been doing that for many years and it has not worked. So those are my messages to RFK Jr. Love him or hate him, he's poised to make some changes to our American healthcare system, which is both exciting and a little bit scary. I'd love your comments below on what you think RFK Jr. should focus on as head of the Department of Health and Human Services. Thanks for joining me.